Have you ever paused to wonder just how often seniors should really shower? It's a question that might not have as simple an answer as you might think. Let's take a deeper look at the showering habits of older adults. We've long believed that everyone, regardless of age, should shower daily, a habit as routine as the first sip of coffee in the morning or catching up on the day's news. For many, the act of showering is woven into the very fabric of personal hygiene, an essential ritual that refreshes the body and mind. The feeling of stepping out of a shower, skin tingling with that fresh, clean sensation and the scent of soap still lingering, is universally comforting. This notion of daily showers is not only ingrained in our individual habits but has also become a cultural expectation. Across the globe, from the bustling streets of New York to the quiet towns of Melbourne, daily showers are considered the cornerstone of personal cleanliness. But here's the reality check: this one-size-fits-all approach may not suit everyone's needs, especially when it comes to seniors. Just as we each have unique tastes in food, music, and clothing, our bodies too have distinctive requirements when it comes to personal care. For many older adults, the expectation of showering every day could, in fact, do more harm than good. You might be thinking, but cleanliness is vital for health. And you're absolutely right. Cleanliness remains crucial, but it's worth considering. Have we been conditioned to think that frequent showering is synonymous with good hygiene? Could it be that we've equated the act of showering daily with maintaining true cleanliness? In truth, frequent showers may strip the skin of its natural oils, leading to dryness, irritation, and even increased vulnerability to infections, especially for older adults, whose skin tends to be more delicate and prone to such issues. It's time to take a step back and reconsider this long-held belief. Could it be that less frequent showering might actually be better for the health of our seniors? Let's explore the research, the science, and the surprising insights that challenge the idea that daily showers are always necessary for older adults. What do the experts have to say on the matter? When it comes to bathing habits for seniors, it's not just about preference. There's a growing body of evidence showing that too much frequent showering could actually have negative consequences. For instance, a study from the University of Pittsburgh highlighted that frequent showers can harm the skin of older adults, whose skin is thinner and more vulnerable to damage. Daily exposure to hot water and soap can lead to excessive dryness, resulting in itching, cracks, and even infections. Similarly, research from the University of California, San Francisco, confirmed that hot showers strip the skin of essential oils, potentially triggering conditions like xerosis, characterized by flaky, rough, and irritated skin. Even respected medical journals like the New England Journal of Medicine have pointed to studies showing that seniors who shower less frequently experience fewer skin-related issues. It's time to rethink the daily shower. For seniors, less might actually be more when it comes to maintaining both cleanliness and skin health. Let's uncover the real story behind this everyday ritual. Skin tears are a painful reality for many older adults, often taking longer to heal and significantly increasing the risk of infection. But it's not just about the health of the skin. Daily showers can also pose broader concerns. The American Geriatric Society highlights a key risk: wet, slippery surfaces can make falls more likely, and falls are one of the leading causes of injury among older adults. Additionally, the Journal of the American Medical Association raises another important consideration: the physical demands of showering itself can lead to fatigue, shortness of breath, and strain on the body, particularly for seniors with certain health challenges. It's important to clarify that these studies are not suggesting seniors stop showering altogether. After all, cleanliness is essential for overall health. However, they do suggest that showering every single day might not be the best practice for older adults. So, what's the best approach? The consensus emerging from these studies is that balance is key, a balance between maintaining personal hygiene and preserving skin health, between enjoying the comfort of a daily shower and recognizing the physical toll it can take. Experts suggest that many seniors might benefit from showering less frequently than daily, depending on their individual health and needs. This could mean showering every other day, twice a week, or even less frequently. These findings may be surprising, particularly in a society that often equates cleanliness with a daily shower, but it's crucial to remember that each person's body is unique. What works for one individual may not work for another. So, if daily showers might not be the best routine for seniors, how often should they shower? Brace yourself for a surprising answer. Experts actually recommend showering only once or twice a week. Yes, once or twice a week. This suggestion, of course, varies depending on the person's physical activity and health. Before you react in disbelief, let's consider why this recommendation makes sense. As we age, our skin becomes thinner and produces less oil, which means it's easier for the skin to dry out. Frequent showers can worsen this condition, leading to dry, cracked skin that increases the risk of infection. Additionally, many older adults face mobility challenges that make daily showering difficult or even dangerous. The act of showering itself can heighten the risk of falls, especially in the bathroom, a place where many seniors experience accidents. Also, it's worth remembering that our bodies have natural self-cleaning mechanisms. Overshowering can disrupt these processes, stripping away the beneficial bacteria that are essential for healthy skin function. Another factor to consider is the level of physical activity. Many seniors do not engage in strenuous exercise or activities that cause heavy sweating, so they don't need to shower daily. However, those who remain highly active or have specific health conditions might need more frequent showers. In the end, there is no universal answer to the question of how often seniors should shower. It's about striking a thoughtful balance, one that honors both hygiene and the body's natural processes, while also accounting for the individual's health and lifestyle. Perhaps the most surprising takeaway is that societal norms and personal habits around showering aren't always aligned with what's healthiest for our bodies. Surprised? Let's dig deeper into the reasons behind this recommendation in the next section, where we'll explore these ideas in greater detail and offer some practical advice. Stay tuned. Why would experts suggest less frequent showers for seniors? Let's break it down. As we age, our skin's natural ability to produce oils that act as a protective barrier diminishes. These oils help keep our skin moisturized and healthy, but with age, their production slows down, leaving the skin more susceptible to dryness and irritation. This can result in itchy, uncomfortable skin, and, in more severe cases, even conditions like eczema. Frequent showering can exacerbate this by stripping the skin of its essential oils, which are vital for maintaining moisture and protection. When the skin loses these oils, it can become cracked and more vulnerable to infections. Therefore, for seniors, less frequent showers can actually help preserve the skin's natural defenses and reduce the risk of complications. Now, let's talk about safety. Bathrooms, especially showers and bathtubs, can be hazardous environments. Water and soap create slippery surfaces, and without proper safety measures, these areas can become fall zones, particularly for seniors who may already struggle with balance or have physical limitations. The Centers for Disease Control and Prevention, CDC, reports that nearly 1/3 of adults aged 65 and older experience a fall each year, with a significant number of these falls occurring in the bathroom. By reducing the frequency of showers, we can minimize the chances of these potentially dangerous and sometimes life-altering accidents. Additionally, certain health conditions can be worsened by frequent showering. For example, individuals with respiratory issues may find that the heat and humidity from a shower can make breathing more difficult. Similarly, those with arthritis may experience pain and discomfort from the physical act of showering. On the other hand, some seniors may have specific health concerns, such as incontinence, that require more regular hygiene. In such cases, alternative methods like sponge baths or using wet wipes can be effective for maintaining cleanliness without the risks that come with frequent showering. It's important to remember that this advice is not a one-size-fits-all solution. The frequency of showering depends on the individual's health, lifestyle, and personal preferences. It's always best to consult a healthcare provider to determine the most appropriate and safe approach for each person. So, while less frequent showers can indeed improve seniors' health and safety, how can they maintain good hygiene? Let's explore that in the next section, where we'll offer some practical hygiene tips for seniors. Stay tuned. Maintaining hygiene doesn't always mean taking a shower. This is a concept that might raise a few eyebrows, but it's crucial to understand that hygiene is more than just skin deep. It's not only about cleanliness, it's about preserving health. For many seniors, the daily shower routine can be more challenging than it seems. So, let's discuss some alternatives to help maintain good hygiene without the need for frequent showers. First on our list are wet wipes, not just for babies. Adult wet wipes are an excellent way to freshen up without taking a full shower. They're gentle on the skin and can be used to clean the face, hands, and body. Plus, they're convenient and portable, allowing seniors to use them anywhere, at any time. Just be sure to choose unscented and hypoallergenic options to avoid skin irritation. Next, let's emphasize hand hygiene. Regularly washing your hands is one of the most effective ways to prevent the spread of bacteria and viruses. It's a simple yet powerful step in maintaining cleanliness. Be sure to use soap and warm water, scrubbing thoroughly for at least 20 seconds. Don't forget to dry your hands completely afterward. And, for those times when washing with soap and water isn't possible, keep hand sanitizer handy. It's a great backup for maintaining hand hygiene on the go. In the next segment, we'll dive deeper into more practical tips for seniors to maintain hygiene without the need for daily showers. Stay tuned. Soap and water aren't always readily available, so let's look at other ways to maintain good hygiene. Oral hygiene is one area that's crucial to our overall health. Brushing your teeth at least twice a day and flossing regularly can help prevent oral health issues such as cavities and gum disease. Plus, it leaves your mouth feeling fresh and clean. Clothing hygiene is another key consideration. While changing clothes daily may seem like a given, it's worth highlighting the importance of fresh clothes and helping you feel cleaner and more comfortable. It's also a good idea to change your bedding regularly to keep your sleeping environment fresh and inviting. Additionally, proper grooming plays a significant role in hygiene. Keeping your hair, nails, and beard, if you have one, neat and tidy can have a powerful impact on how you feel about yourself and your overall well-being. These are just a few examples of how you can maintain good hygiene without the need for a daily shower. The goal is to find a routine that works best for you and stick with it. After all, maintaining good hygiene is not only about cleanliness, it's about taking care of your health and well-being. Whether you shower daily or choose alternatives, the most important thing is ensuring you feel healthy, comfortable, and confident. It's clear that shower frequency isn't the be-all and end-all of hygiene. It's about tailoring your routine to your personal needs and circumstances. Hygiene is a deeply personal matter, and there's no one-size-fits-all solution. Let's take a moment to recap what we've learned today. Our journey began with a thought-provoking question: how often should seniors really shower? We challenged the common belief that daily showers are a must for everyone, regardless of age. Research, however, paints a different picture. The truth is, seniors do not need to shower every day. In fact, daily showers can strip away essential oils, leaving their skin dry and vulnerable. This surprising fact might contradict what many of us have been taught about the importance of daily showers, but it's crucial we understand this to safeguard the health and comfort of our seniors. We also explored why this is the case. As we age, our skin becomes thinner and less oily, and frequent showering can worsen this condition, leading to dry, itchy skin, and even infections. For many seniors, showering every 2 to 3 days may be more appropriate. Finally, we offered some practical hygiene tips for seniors, using mild soap, moisturizing regularly, and focusing on cleaning the essential areas such as the face, underarms, and groin daily, even if a full shower isn't possible. Remember, it's not about how often you shower, but how you maintain your hygiene that truly matters. Stay clean, stay healthy, and above all, stay comfortable in your routine.